Right now, political commentators Neil Jones and Bridget Morton today. Kia ora korua.
Morning.
Now, let me just run through your references and disclaimers. Neil was Chief of Staff to Labour leader Jacinda Ardern, and prior to that, Chief of Staff to the then leader Andrew Little, and is now Director of Capital Government Relations. Bridget Morton's a director with public and commercial law firm Franks and Ogilvy and a former senior ministerial advisor for the previous National-led government. Where do we even begin with today? It's now a roadmap. What needs to be said this afternoon by the Prime Minister at 4 o'clock post-Cabinet, and what sort of a juncture is the government at, not only in its decision-making, but its messaging? Who would like to begin?
Oliver, go. I think, Catherine, you're right, it is a juncture. So far, the plan has been bring the current outbreak under control, get vaccination rates up to sort of 90% plus, and then open up in the first part of 2022. And while I'm sure everyone agrees that it would be a good thing if we could get the virus under control, under level 3, it is looking increasingly like there needs to be I would say plan B, but that's been ruined now, but another plan for if that doesn't happen. And that's going to be really hard because any reduction in restrictions until we have vaccination rates high enough is going to lead to a New South Wales situation. We'll very quickly have uncontrolled spread. You'll see a health system overwhelmed. It's really ugly stuff. So that means the government needs to, I think, give a really clear view about how we get those vaccination rates up as fast as possible. And I think, the only way that I can see that happening, if you look around the world, is probably a pretty hard vaccine mandate involving both employment mandates and vaccine passports, saying with clear dates about when people have to be vaccinated by. And saying basically, if we get that done and we get to 90% plus across the population, we can open up. But unless that happens, I think it's going to be very hard. I just don't see a scenario where Auckland can stay in lockdown until sometime in 2022.
I think Neil's right that it's a juncture, but I think a slightly different one, than what he's sort of putting out there. I think what I've seen over the last 24 hours is a recognition from the government that it's not just, that they haven't been making these decisions purely on science, and they can't. They actually do have to make them based on politics, and I say as small p politics, around that social cohesion and that social license. And they know that to keep people on board and people, adhering to restrictions, that they have to give them some leeway and look like they're understanding and listening to them. So I think you can see that particularly, Jacinda Ardern this morning on radio talking about the fact that, we're probably not going to see an alert level kind of change this afternoon, but instead we're going to see some easing restrictions that, matches with where they can take some risk and putting them on where they can't. So, we're obviously going to still have level 3 in the Waikato until they determine where that community transmission is, that science-based approach, but they recognise in Auckland that more and more people are taking risks at the boundaries of those restrictions. So they need to give a little bit of leeway there so that people can feel like they've got some control.
The messaging and the wording is changing and needs to change. We had this torturous debate over the exact meaning of elimination. It now seems to mean not 0 cases in the community, but broad control, as it was defined at the weekend. It's now something between the elimination that we talked about and celebrated when we had 100 days of no new cases that we knew about anyway, and suppression, which is this managing outbreaks, keeping them at a level where hospitals aren't overwhelmed. I'm wondering if a new vocabulary is needed, Bridget, that is more usable in an environment where the past 18 months is one thing and the next 2 to 3 months and beyond something quite different.
Yeah, I completely agree. I think there is. And I think that is about bringing people with you. We've had the discussion about the fact that that sort of climate of fear, people being scared of getting COVID that existed when we went into lockdown last year simply doesn't exist to that same extent. Therefore, to actually have people, buy into the response and do the things that need to be done from a science perspective, you do need to be providing, I think, more information. You need to be more accountable. And I think you've got to be really upfront about the things that are going to happen and the timeframes of that, so people have something to work towards.
I think one of the issues the government has at the moment is it's not clear to people what the next step of the plan is. And that's why today I think is really critical that they do lay out what the next step is. I think that, like I said, it does have to give a clear path to how we get back to normality if we can't get COVID back under control. And I think, by all means, there might be very good reasons why you have to give a little. Jacinda Ardern talked today about, relaxing some restrictions short of an alert level change. I just think that would have to be justified and accompanied by a clear pathway out, because by itself, reducing restrictions while case numbers rise seems counterintuitive.
They are in a dangerous place where, and we heard from Michael Plank again this morning, the potential for what we would call a New South Wales or a Melbourne-style outbreak is absolutely there. At the same time, they are needing to begin a conversation about the rewards of getting near to the vaccination levels the modellers tell us would, again, do two things. Manage the stress on hospitals, which are already stressed and were with no COVID when it comes to ICU, and a conversation we're uncomfortably going to have, which is the level of fatalities we will have with Delta endemic over the coming months and years. And that conversation will end up being a discussion about the number of flu deaths, say, that we tolerate each year. So far, it has been zero tolerance. A roadmap forward will be talking about different metrics. And I'm wondering how they are going to communicate that and when. What do you think the key factors of that are?
Well, I think from my perspective, one of the things I thought was really interesting reading the National Party's plan last week, which, was actually an extraordinary amount of detail, particularly coming from opposition, is that we just don't actually have the visibility on a lot of those, suggestions that are in there. Nothing was particularly, I would say, from the national plan, novel. It's not like they're trying to move way ahead of the rest of the world. A lot of the tools they put in there were exactly the tools that are operating around the rest of the world. But for most of them, I couldn't actually work out or understand what the government was doing in these areas. Even the things like, that rapid saliva testing, it's really opaque about when that will actually be rolled out in New Zealand, even though it's become completely commonplace, outside of the rest of the world. So I think, if today, at PostCab, we get just the standard, half an hour, this is what we're changing around alert levels, everyone please be kind, essential workers, we really appreciate you stick. It's not going to carry through, because people are actually looking for not just, when they get more freedoms, but people do want some security in knowing that, we're not going to be behind the world again like we have been on vaccines, that we are going to be up there, that we are going to have pathways for people to come in and out of the country, but have the ability to test people on borders, etc. And that's the kind of I suppose, rights and responsibility balance that we need to see from the government.
Are they wary of taking any attention away from vaccination at the moment, though, Neil? And is that one of the reasons that a lot of the tools that will have to be in place and functioning optimally when we do get to any sort of an opening, even further openings internally with COVID in the community rather than externally, are they worried about diverting away from the message at the moment, which is the faster and the higher the vaccinations go, the quicker we get out of this?
I think definitely vaccination is the only message at the moment from the government, and we heard that shift in messaging from Jacinda Ardern yesterday in her press conference. She very much said, if you're not getting vaccinated, expect to be locked down. If you want to be out of lockdowns, get vaccinated. I do think a lot of the tools that Bridget mentions are things that are happening around the rest of the world. The reason why not all of them are happening in New Zealand is because we still do have an elimination strategy where we try to stop any cases getting through the border and we try to stop any cases spreading. And while that happens, there is very little tolerance for risk. So most of these are tools that have a higher error rate, but help to reduce the spread. And they will come more into focus, I think, as we move into that next stage, which is once we have higher levels of vaccination and we change our strategy to managing the spread. If I could just touch on National's plan that Bridget mentioned. Again, I agree that nothing in there was particularly revolutionary. Most of it was stuff the government is working on. I think that's useful, though. It's useful if there's bipartisan agreement on what measures we should use. And any urgency is good because, the health system can be sluggish at times. I think where National's plan fell down, and let's be clear, it did fall down, is when Shane Reti, their health spokesperson, admitted that, the arbitrary date of Christmas to open up and the lower vaccination rates that they would require would lead to our health system being overwhelmed. And we'd require a whole new hospital full of beds by Christmas. That's 800 ward beds. We'd need 100 new ICU beds. We'd need hundreds of new nurses. And it was just reckless. And I think that's, this discussion is really important because we will get down to that point of how much death, how much sickness are we going to tolerate, and what are we going to do about our hospital capacity? And that's ultimately where this leads, no matter where you're coming from.
Go ahead,
I think
Bridget.
where I just question that, though, is the fact that, the Prime Minister herself said this morning, we're in transition. Elimination was the right strategy, she says, when we were trying to get vaccination rates out, but we are in transition. If we're in transition, I think that we, as the team of 5 million, get to know what exactly that means. Does that mean, that I will, I need the vaccine passport? Does that mean that I'll have availability to get a saliva test, if I'm in an area of interest or, a person that's an essential worker? Like, I think that the problem is that because there's been this kind of elimination, we've got this completely opaque, policy announcement that they refuse to kind of take into account or speak publicly about any other measures that we could also be working on. And we know that almost everything, you say the health system is sluggish, but there's also a lag because, almost all of these measures need some sort of approval or need some sort of, systemic setup. So they need to actually be doing that work now before we're actually in that transition, rather than just waiting until elimination is no longer possible.
Well, I mean, there has been a big announcement. I think, people seem to forget this. Most columnists, former Prime Minister John Key, seem to forget that just a month or two ago, there was a big announcement about reconnecting New Zealand, which went into quite a lot of detail about the next steps out. The point I was making earlier was that we may not have the luxury of waiting a few months to get vaccination rates up among that hard tail who are just selfish or confused or for whatever reason refuse to be vaccinated. And that's why I think there needs to be a bit more clarity today around what steps would be taken to speed up that vaccination of that hard tail. And I would look to, for example, the US. Joe Biden has announced every government employee, every business reliant on government funding, every private sector firm over a certain size must be vaccinated. I know a lot of businesses in New Zealand are saying we've got health and safety responsibilities. We need some clarity on what conditions of employment we can have.
Well, that's what they're calling for. Business is calling for a government mandate to requiring vaccinations. So are they going to go there? I mean, they're so reluctant to make anything compulsory.
Exactly. And I think I heard the PM pleading with people to get vaccinated yesterday. I think given where we are with COVID, I think the time for nicely pleading is over and we just need to get some mandates in. The other one's, vaccine passports. We talked about this recently. Ireland's got over 90% vaccination. They've talked about how vaccine passports, really restricting what people can do if they haven't got vaccinated. That has had a huge impact. So, I think it's time now to just start to say you've had a good chance to be vaccinated. The hammer's going to come down.
Do you believe that too, Bridget? I tell you where I think their reluctance has been, and it's the same with this debate over whether the Tamaki, gathering should have resulted in arrests. What they don't want to do is harden the attitude of those who are still ambivalent or for whom this is, I don't want the state telling me what to do, with video clips of, a leader of that gathering being taken away by the police in handcuffs. You can imagine how that would have played amongst the very audience they are trying to get moving. But are we at a point now where trying to hold back on compulsion so that you don't feed that rhetoric is running out of time?
Yeah, I think I have concerns around making it mandatory because it is a really blunt instrument and you do completely another. We've got a group of people, we've kind of got two people. We've got people that are, quite slack. There's people that are scared and then there's people that are, hard, that they, have, bought the conspiracy theories, believe there's government control, all of those things. So I think what we have is some concern, particularly around those people that are scared, that we actually push them further towards that conspiracy, end of that spectrum. And what is going to happen is not just, we're not dealing with COVID in a vacuum. We've got to remember that we are going to have multiple medical interventions. Who knows? And, knock wood, this is, the only pandemic that I see in my lifetime. But we have to be conscious that we've got a longer term thing about actually we need those people to be in the tent rather than outside of it. And I think there was a really interesting and quite depressing, slightly frightening vox pops done on Q&A yesterday, where there was literally people saying that they had lost their jobs, they're being vaccinated. They, were saying, I will never travel overseas again because actually, weighing up, I'd rather not be vaccinated. Those are the people that we need to be talking to. And I think what you're going to do if you put mandatory vaccination in, blanket across the board, is that you're just going to push those people harder and harder into their position.
What I look at, though, is what's worked, for example, with the port workers, where there was a lot of vaccine hesitancy. There were lots of stories about how people were refusing to be vaccinated despite the fact there had been vaccine stations sitting there. What actually worked was a mix, right? There was some education. There was some work done with the unions, with the employer, to educate them, but also there was a public health order that said you must have your first dose by this date and your second dose by this date, and 98% are now vaccinated. I think also sometimes the idea people will quit rather than get vaccinated is overblown. I mean, in the US, United Airlines has 67,000 employees, only 600 refused to comply, and once the deadline passed, only 300 actually refused to comply. So it's very small numbers who, when it comes to the crunch, will actually hold on.
All right,
I think though we can take another step before that, which is around just that information for employers on what the current position is. Because, we are heading towards summer. We're heading towards, when people are trying to employ people or, people, they're looking at people coming out of lockdown. And at the moment, there is a complete and utter, desert of information or advice available to employers on what they can and can't do tomorrow, the next day or next week.
Yeah, and certainly I think, the government could sit down with Business New Zealand and the CTU and work something out. Maybe say, look, any employer can require their staff to be vaccinated as a condition of employment, but you've got to give them half a day off per shot and $50 costs or something.
This is the other thing. Your employer might say, we'll give you $200 and we'll bring the bus here. If they knew the ground they were on, they may well become part of solving the problem. Yeah,
but there definitely needs to be some clarity.
And also, you remember, it's not quite as simple as because there's lots of legal considerations here. And without going too deep into it, basically you will need an act passed by Parliament that puts a line in the sand. Otherwise, those employers that try and rely on that advice, a lot of them are going to get caught up in lengthy, legal debates. We've got a number of cases, currently around employment and vaccine mandates. We don't want that to be more. The government actually needs to take the action to keep our employers and therefore their employees safe.
Yeah, and also, as we said, if they felt they were on solid ground, they may be the ones putting the incentives in front of their own employees to get them done, rather than this truly risking a further delay while everyone waits to see if it happens. Rather than risking that the government does that, it may be individual employers or other organisations that take that lead, as long as they know they are on solid ground. Okay, let's look at something else that happened last week, or other things that happened last week. A lot has happened in the days since, but there was a sense that there was a sudden urgency or busyness around the government and some of its announcements. I've lost track of how many there were last week, but one of the more significant was the immigration change that was announced, which many have been calling for on this program and elsewhere, and certainly National's immigration spokesperson has done a lot of work on this as well, which is, for goodness sake, for those who are here, stuck here, many of them, separated from families, contributing and helping reduce an already acute labour shortage, give them a break on visas and a pathway to residency. Is it welcome, Bridget? And would everyone welcome it?
I think it's definitely welcomed, and mainly because it's dealing with people that are already here. So those kind of traditional concerns people have around immigration, we're going to suddenly be flooded across the borders with people taking our jobs and taking our houses, doesn't really exist because these people are already here with the jobs and the houses already. So I think what concerns me, though, is that announcement was made. It was made in terms of who could, possibly, get in on this pathway. And then some statements were broadly made about timelines that would happen in and targets. Now, the number one thing we know that this government doesn't do is deliver and deliver on time. And so immigration is an area which is, even before this government, many, many years, decades of inefficiencies and blockages and slowdown. I'm not entirely confident that the promises that the minister made last week he can actually deliver on, given that the Auckland offices have been closed down for all of lockdown because they're still a paper-based system. So I think, welcome announcement, but I would like to be pleasantly surprised on this when they actually pull it through.
Neil?
I wouldn't be as cynical about Bridget about the ability to follow through in it. But look, I mean, what else is there to say? We sat months ago back when we were in the studio talking about how the government should just give residency to people who are here, how it seemed like a complete no-brainer, and it only happened last week. I think there's been a lot of unnecessary angst caused, and frankly, the government has created a political rod for its own back that it didn't need to through some pretty sloppy political management.
There was some other announcements as well. We won't go into more detail. Some of them controversial. Bridget, you might want to pick up another time on the landlords, the fair proportion clause, if I can call it that, that's now been added as an obligation on commercial landlords where tenants have been affected by COVID. I guess everyone hoped this was something that would happen voluntarily. Certainly the government did, but it's caused some controversy that it's been done by fiat, shall we say. The other one that's quietly slipped away in the last 24 hours or so was the walking and cycling bridge. And I think, Neil, if I recall, you believe that should have been done loudly, shouted from the hilltops, and a long time ago.
Yes, it is always a pity when you make an announcement as a government, you take the political hit, and you don't even get to do the thing you want to do. So it has been sort of a futile exercise in spending political capital. But look, I think they've done the only thing sensible politically, and that's done now. So good on them.
Bridget?
I think the thing that comes through to me of all of these sort of announcements, and it's a bit of a theme sometimes I often have around this government, is the lack of early detail and sort of discussion. So, the commercial landlords sort of came out of the blue. Big stakeholders like the Property Council and things were suddenly like, what is happening around this? The announcements that went through in terms of, the legislation went through in terms of the interest deductibility for, landlords, all of that stuff was announced way back in March, and people only found out actually what was happening when it went through last week. So I think, whilst there's a sense of busyness, it's saying things in this government in terms of not going out and putting that information out to people, working with them instead of just throwing it over the top of them and expecting them to catch up.
Thank you both.
I do think, though...
Oh, finish, Neil. Yep.
Can I say, both of these things were very early signalled on. The commercial leases thing was covered in depth during the last lockdown in 2020, and the mortgage interest deductibility, there was a whole consultation with IRD. So this stuff's been pretty well traversed.
Thanks both. Neil Jones, Bridget Morton.